Welcome to the MSL 411, a podcast designed to equip both aspiring and experienced MSLs with the resources they need to level up their career toolkit. The heart of this podcast is to take the same industry knowledge and advice that we share with our own candidates and make it available and accessible to anyone looking for answers. So if you have questions, you've come to the right place. We're here to give you the 411. And without further ado, let's dive right in. Hey everyone, and welcome back to the MSL 411 podcast. We have another guest with us today we're very excited about. And we have Shannon Colton joining us. She is a PhD, and she is someone who comes with a wealth of knowledge on all things related to MSL training, onboarding, certification. And so we thought, who better to talk about this topic with you guys and maybe share an insider's input on what goes on behind the scenes in that training process, what onboarding looks like, what it takes for certifying as an MSL once you've gone through training. And so wanted to welcome her to the show with us. Thank you so much for being here with us today, Shannon.
Well, thank you for having me on. I'm very excited to be here.
So tell us a little bit about yourself, your background in medical affairs, maybe a little bit about what you're doing these days, and kind of share with us a little of your story.
Great, happy to. So as you mentioned, PhD by training. I spent the first half of my career in the academic sector. So I was a, faculty member at a university teaching classes, but then I also spent a good portion of time in science education outreach. So helping teachers be able to teach their biology classes in a little bit of a different way. We did 3D molecular printing. So we took 3D printers and made models of proteins, DNA, all sorts of things so that students could really understand those abstract concepts by putting their hands on them. So like physically picking up the protein and being able to see what it does or how it functions. I did that for a long time, maybe about 12 years, and learned a lot about pedagogy and how to teach and how to learn and how to engage people in all of that learning process. And then after that period of time, I just kind of got to the point where I was not learning as much as I wanted to. So it was an opportunity for me to grow in a different way. I was reaching out to friends and just talking like, what else can you do? If you have your PhD in biology, what can you do? And a friend of mine was an MSL manager at a pharma company. And had been talking to me for years about MSLing and what she did and as a manager. And then as she picked up a medical director position, she was learning more about the company that she was at. And she's like, there's this thing called training. And I was like, I can do training. I know a little bit about that bit of it. And so I joined a company in their global medical training group supporting products that were in launch. And I spent maybe about like a year and a half in that global space. And then I was recruited to come over to the US side to work more directly with the MSLs. And I really, really enjoyed that transition because I was working very closely with the MSL team and the US medical team and really thinking about how do we make sure that we're aligning training to really help the team develop not just their content knowledge, but their skills in order to really be effective in the field as they're communicating science and bringing back those insights to the company. And so I did that for a while. And at some point, I kept hearing people tell me things like, well, you really can't be an MSL trainer if you've never been an MSL. And I'm like, kind of showing you I can, but that's okay. I understand what you're saying. So at one point there was an opportunity for me to join an MSL team. And I thought this is a great chance for me to really put my feet in those shoes and really understand what it was to be an MSL. So I did the role for a while, but I really just missed the training. I really enjoy that element of it. And so after a period of time in that MSL role, a job opened up at a different company to build out their medical training team and to support a product that was in launch. And so I hopped back into the training world and had the chance to build out a team. So I worked really closely with the medical directors, the field medical directors as well, to find a whole group of people. Like we really built the team out. It expanded quite large, but it also meant a lot of onboarding. So that was my main role for probably the first 9 months I was in my job, was to onboard a whole series of people in support of that launch that was upcoming. And from there, it was opportunities kept coming from a standpoint I could learn my area with my therapeutic area that I was in, but then I also was offered the chance to head up the medical excellence and training team. So I hired people to come in and support the different therapeutic areas and grew out from a standpoint of just not content training, but field excellence. And so I was in that space for 4 or 5 years or so. And at some point, I just kind of got tired of being in meetings all day and not really doing the training that I missed doing. And so I said goodbye. Thank you so much. I had a great time. And I put a post up on LinkedIn that said, hey, I want to just do training. And if you need training as a consultant to come in to support you, please let me know. And so I started my own company and became a training consultant, which I've been doing now for the last 2.5, almost 3 years, where this is my chance to work with a lot of different companies, ranging from kind of small biotech where you have an MSL team of like 3 or 4 people, all the way up into larger companies. As a trainer, we used to rely on vendors a lot as well, just to help us ideate or come up with new things or just kind of re-energize our own thinking. So I partner with people to think about how they're going to do training and what they need in order to really help their team. So that's what I've been doing for the last 3 years, and just enjoying being in that space of focusing on training and making it an integral part of their field excellence strategy.
I think that we actually, when we first, Ashley and I first encountered you a couple of years ago at a conference, you were just in the middle of that transition from training to more of like a consultative position. And so it was interesting to kind of hear what you were stepping into, but also to still receive a training in one of those conference sessions on your methods for training and onboarding MSL teams. And I've got to say, you've got a really unique take on it. So I'm sure we'll dive a little bit more into that. But
Yes, I would agree with the unique take. I know for a while people were looking at me kind of sideways, like, what are you doing? And I'm like, no, this is more fun. This is the way we should be doing it. This is how training should be. It shouldn't be somebody just standing in front of a podium or a screen lecturing us or going through slide decks point after point after point after point, because the MSL role isn't about presenting data from a podium. It's about having a conversation and sharing data and asking really good questions and bringing those insights back. And if your training is just people lecturing you, you're not developing the skills that you need in order to really be effective in your role.
Absolutely. And I'm thinking about the people who are probably listening to this. They are mostly going to be aspiring MSLs who have never sat through a training before. So could you talk a little bit about when someone is coming into their first MSL role, what does the structure of their onboarding training look like generally in your experience?
So it depends so much on the different companies. I have worked with people who have told me that their training consisted of them being handed literally a like 3-inch binder of all the papers and posters, and like, you have 2, 3 weeks to go through everything. Let us know when you're done and we'll send you out in the field, which is kind of terrifying, especially if you're new to being an MSL and that's what you're given is like this whole big pile of papers. And you're like, what am I supposed to do with this, right? So when I started doing onboarding, I really thought about it from an angle of like, what's the critical skill set that we need to ensure that the MSLs can do? And again, if I'm the one that's lecturing you, I know the content, but are you really learning it on that passive side of it? So in my world, onboarding consists of, yes, knowing the scientific content and really getting into it and understanding the mechanism of the disease, the pathophysiology, understanding the way that the disease is diagnosed and all of that that goes into like kind of the clinical practice of it, but then also understanding your own clinical trials and the mechanism of action for the product. And so there's that content piece, but then there's all of the skills that are associated with being in the field and having an effective engagement process. And that's where I try to blend them. So the onboarding program becomes things like learning the data from the poster or the papers or the slide decks that are available as resources, but then having them actually presenting it to me or to a group of people that we're working through and challenging them with questions. Well, if a doctor asks you X, what would you say? How would you respond to that? What are questions that you can ask to clarify or to really pull out their thoughts and ideas so that you're gathering those insights? So depending on the company and how they're doing the onboarding program, hopefully is blending both of those together, the content and the skills. But it's usually a few weeks. Just depends on how many products you're covering. If you've got a portfolio, it may take a little bit longer. It also depends a lot on the urgency to have somebody in the field. I've had people ask me to get a team of new hires into the field within like 3 or 4 weeks. And I'm laughing, going, you have a portfolio of 5 or 6 products in this one disease state and you want them to be in the field in 4 weeks? Okay, we can not do that. So, working very closely with the team to really identify like what is it that you need them to do? And can I get them out in the field around this topic first, and then maybe add on as we're going through multiple therapeutic areas, if that's the case, or if it's this product's the priority, let's focus on this and then adding it as we go. But fundamentally, a good onboarding program should allow you the time that you need in order to really learn the content, but also blend all of their training, not just with the content, but with the skill development, so that you have that practice, you have that opportunity to learn how to have those conversations in that particular therapeutic area.
And the aim, of course, is for them to pass their certification and be field ready. But it is a big risk shoving somebody out in the field who's not ready. A risk to the company, to their reputation, to all of the things.
Which is why that certification is so important, and not everybody does that. So when you talk about it, I'm actually happy to hear you say, yes, field readiness certification, because you do need someone to kind of sign you off to say, yes, you are going to talk about the product accurately, compliantly, and present the data appropriately. So we always did certifications for all the MSLs that I've trained, because I think it is critical just to verify. But it also gives them a sense of accomplishment as well, like in the sense of, if you go into a new therapeutic area and you're learning all that content, and if you're also going in as a new MSL, you're learning skills. So having somebody just kind of give you a little bit of a stamp of approval, if you will, it helps you feel confident that you know what you're doing and you're going to be good out in the field. There's still a ton of learning that's going to take place on the job, but at least you're not going out kind of unaware of what the expectations are.
And there may be a few of our listeners who, like we said, maybe in that aspiring MSL situation where they're like, okay, I've heard of onboarding or I've heard of training and onboarding, but certification may be a new term for them. Can you talk a little bit about what that looked like in your experience?
Yeah, so what we did, when I was with the US team way back at the beginning, I really put forward this idea of, you have like a checklist of what you need the MSLs to be able to demonstrate. So we put together kind of a simple rubric for people to use with their certification process to say, as a new MSL, I expect that you are able to talk about the label, the label, or about how the product works. You can explain the mechanism of action clearly and concisely. The clinical trial data. So your content. So just kind of verifying that you know it. But it's not enough just to know the data. I've seen people do tests, like, do you know the data? And that's fine, because it does check the box that you know the content, but there is a very big difference between knowing the content in your head and being able to articulate it and to be able to have a conversation around it. So we like to see that in action. So the certification gives a chance for new hires to demonstrate what they've learned during the onboarding process, to really say with confidence that I know this individual can speak to the content, but can do so in a way that's going to not put the company at risk, not put the individual at risk, and to really be effective in the role and bring value to the provider.
Such great points. I don't think I actually knew that not everybody does this certification. I feel like so many times you talk to MSLs, after you place somebody, you call them up, see how they're going, how things are going and everything, and they're on the verge of their certification process. I guess I just assumed that was standard.
Becoming a lot more standard for certain, but
Okay.
there are still some companies that they don't. They either, or they don't make it a formalized process, so they have someone who checks in with them and just says, yeah, they know what they're talking about, and they can go out into the field. But I've also talked to a ton of people who, especially at conferences like the one we were at together, where they don't check in, and it's this sort of this assumption that we hired you, you're a smart person, you can acquire information, you know what you're doing, and good luck to you as you go out into the field.
Well, that's good background information to know, because if you are listening to this and you are in an interview process, we always encourage people to ask about what the training looks like, but really do some diligence, because there is companies out there that are shortening that process, or not really having that as a developed part of their onboarding program. So that's really good to know, I think, for people to think about and consider in the interview process. So my next question was also on the topic of the training portion, that is more art of MSLing versus it's soft skills versus the scientific part. Can you talk about what that kind of split would look like?
Yeah, I often talk about the science of MSLing and the art of MSLing and how you have to blend the two together in order to really be effective in your role. And I know you use the term the soft skills, everybody does it, and I don't have a better phrase for it, but I feel like when we start calling it soft skills, we sort of downplay the significance of that ability to communicate effectively, to listen, to ask good questions. These are all skills that we say we can do, and for many of us, it's natural and it's routine and no big deal. But sometimes when you're in a role or in an interaction, like with talking with an HCP, and you're thinking ahead to, I have to ask these 3 questions. And also, my flight's going to leave in an hour and I need to make sure I get to the airport. And oh, wait, there was that piece of data I wanted to pull out. Like your head is running a million miles an hour. Are you listening as effectively as you could be in that moment just because you're trying to do so much? And that's where I talk about the role of the MSL. It's a great role. It's super fun to be able to just go out and talk about science and have these engagements, but it's not an easy role. And it is one that can take some time to really develop that skill set to be effective. And oftentimes, the part that really needs the most improvement is not the content, because you're hiring people who have their terminal degrees. They're smart. They've been through school for years and years and years and years. They can acquire and assimilate information. But like I said earlier, hearing and knowing the information up here is very different than being able to actually communicate that effectively. And so any training that I run always blends the two together. We take the content and we pull the things in. So for example, if we have new data that's coming out from a congress, then we'll do trainings that not only focus on the content, like, oh, this is a new data cut, or we have a new outcome measure that we're working with, or whatever the case may be with the new data, but it's the, well, how do I use this? Like, who should I be talking to? What questions can I ask to really gather those insights or to ensure that I'm being understood? Or who are the appropriate people that want to hear this information, and being able to identify that? Or tailoring your responses based on your provider, in the sense of, if you're working with somebody who is a very big picture person and just wants to hear kind of high level overview, if you jump in and start going through every little detail and every little data cut set, you may lose them in terms of their ability to understand you. And vice versa, if you've got somebody who is super detailed focused and you stay up at that high level and never go into the details, they may not feel like they've gotten the value that they really wanted from you. So knowing who your providers are and being able to tailor your responses is critical. So we try to build that all into any trainings that we do, where it's really that blend of both the scientific content piece as well as the art of being an MSL.
Mhm. Interesting point you make, Shannon, because coming into these meetings that they're having, um, there isn't necessarily the volume for you to kind of like learn on the job and learn as you go. Every meeting that MSL is securing is so important. And so you really want to have those scenarios worked out in your mind already before you find yourself in them, because you may not get another shot if that meeting doesn't go well.
And that's part of the reason we put together all of those different ways of learning, so that you have content being shared with you as you would traditionally want it to, but then also thinking about, well, if you were in this scenario, what would you do? Or, hey, you just were told you have 5 minutes to cover information that is going to take 20 minutes to get through. What do you do? How do you handle it? Like, just presenting all of those scenarios during a training and having people talk about it, which is why I love trainings with more junior MSLs as well as with the veteran or the more senior MSLs, because they have experience and best practices that they can share. And so if you are challenging people to think in a training, well, what would you do if something were to happen? And if you do that enough times, when it does happen in the field, and it's not a matter of if, it's when you get those scenarios coming up, you've talked about it, you have some ideas. It may not be the best way to do it or the most perfect response, but you've at least experienced it a little bit. And then that way you don't fall completely on your face in front of an HCP. I'd rather you fall in front of me and we can work through it and talk about it than to do it out in the field, where, as you said, Ashley, if you don't get that chance to return because they didn't see you as being a value add to their day, you don't want that to happen. So you want all those mistakes to happen behind the scenes so that you have a chance to really learn from them and grow, and to have an awareness of what to do if and when something does happen.
We've talked a lot about the onboarding training, but there's also ongoing training, right? So once you're an MSL, of course, that's part of the role of a trainer, is to do the ongoing training. But what kind of ongoing training opportunities do most companies usually have their MSLs perform? What can people kind of expect in that?
Minimally, you're going to get training around any conference or congress that you're going to. So anytime there's new data or a new poster or a new paper, all of that is going to have that ongoing training. Coupled with your own data, usually you have competitive training that happens during the course of your time. It's not going to happen every week, obviously, but especially around major congresses where other companies are presenting their data and just being aware of what else is out there so that when you're talking with a provider and they bring something up, you're like, yes, I do know about that. Let's ask questions and let's pivot and have that conversation now about our product and what we're doing. But I think coupled to, again, content, we go back to the skills development and thinking through how do you continue to upskill your game so that you can continue to grow. And coupled to that, we did at least in my last job that I had, we did a lot around kind of more like professional development in the sense of like leadership development or thinking about if your emotional awareness and how do you show up and how does that reflect and how do you work together effectively as a team. So trying to build multiple facets of the individual, because we know that a lot of MSLs, they'll stay in the role for forever and it's a great role, but then there are a lot that don't. They move on to different roles, whether they're moving into like a medical director position or a manager of MSLs. And so helping them to build those skill sets while they're in role makes them a little bit more marketable, in terms of that next step, what they want to do and as they grow in that space. And so really we try to take it from a holistic standpoint of what do you need to grow and to be not only great in your current role, but let's look down the road in 5 years, where do you want to be? What skills can we start developing now so that when you're ready or there's a position open for you, then you can tackle that role because you've got a little bit of experience and expertise in that space.
That's fantastic.
We also have some people who might be listening to this that are MSLs already that are just looking to kind of sharpen their skills and learn more about how to excel in their MSL role from the recruiting perspective, which is what we offer. So I wanted to ask you a little bit about storytelling. It's certainly a big part of the MSL role. And I was hoping you could give a tip or a resource you have for our audience for somebody who wants to improve the skill. Maybe they know they're not the best at it. They know it's essential to the role.
So storytelling is such a great way to have a conversation with people. We do it. It's just natural. Humans are hardwired for storytelling and really conversing in that space. And I often tell people that storytelling is kind of like the exact opposite of a data dump in the sense that you're not going in to a room and if you're data dumping, you're just, poster after poster after poster or paper or slide deck, and you basically don't give anybody the chance to talk with you. You're just sharing data just continuously. I like to think of storytelling in medical affairs really focused around contextualizing the information so that it is very clear. Why is this important? Why does this particular data set matter to you? So putting it into the context of the provider. And so really telling the story around the data or the MOA, the mechanism of action, or the safety profile or the efficacy profile is really to put it into context. If you just have a whole series of slides with numbers on them, it's just numbers and it doesn't really mean much. But if you put it into the perspective of why does this matter? Why is it important to the individual or to the clinician? It really helps to make that storytelling flow a little bit easier. So it also helps to build your rapport with your providers because if you're putting it into context. So for example, if you have an outcome measure that measure the time it takes for you to walk a certain distance, you can just talk about it to say our drug reduced the amount of time it took you to walk by 5 seconds. You can just say it that way, or you can say there's a 25% reduction in the walking speed. But if you put it into context and you put that story component into it, you can say things like, hey, that 5 seconds allows you to cross the street before the light changes. So you're not panicking about trying to get across safely. Or if the particular therapeutic area also has like a comorbidity of having incontinence, it means getting to the bathroom in time so that you don't have an accident as a professional working adult, right? So putting it into context in that space allows it to just be more meaningful and it connects. And, we were talking before the show about how learning is supposed to be fun and engaging in a way that it helps you remember, we forget so much of what we take in any given day. And we are bombarded with information all over the place, all the social media sites, podcasts, websites, emails that you're getting. So you're fighting kind of a losing battle with respect to information. So providing that content, that story element makes you more memorable so that hopefully people remember the important part. They may not remember that it saves you 5 seconds, but they remember, hey, my patients are going to be able to cross the street more safely or get to the bathroom on time. Or if you're talking in like the oncology space, overall survival, that's more time that patient has with their family, things like that. So putting it into that kind of context just makes it that much more memorable. And hopefully when you leave the office, your data doesn't leave with you, that it stays with the provider.
So what piece of feedback in the years that you've been a trainer has been maybe most surprising to you or even more or most impactful to you? Can you talk about that?
Yeah, I think for me, one of the things that has stuck with me over the years, and I've heard this ages ago and I can't even remember, so I apologize up front that I've forgotten who has told me this, but I like to think about training. This is the company investing in you.
Mm-hmm.
So when you think about you have to go to a training, and it takes away time from something, or you feel like you've already learned this, or some other drudgery that you think training is going to be. And believe me, I have heard all of it. As a quick side note, I interviewed for a job once where they asked me if I had experience being persuasive, and I just started laughing. And I'm like, I'm a trainer who works with people who are highly educated. I have to persuade people all the time that training is a good thing, and it's not a form of punishment. It's a good thing. So I heard someone say once that any training that you get the chance to participate in, whether it's content training or skill development training or management training, it's all a way of the company investing in you. And your responsibility at that point is to try to make the most of it. And we've all been to trainings where they're terrible. I have been to my fair share of them as well. But knowing that piece of advice has always been kind of circulating in the back of my head, I try to take something away from every single training that I go into, whether it's content or a new skill I can try. Oftentimes, if it's really particularly bad, as a facilitator, I will look at it and go, oh, these are lessons of what not to do in order to be a good facilitator down the road. But fundamentally, anything that I get the chance to do, any training, first, I jump at it because I just think it's an awesome opportunity to learn. I love learning. I think we all should embrace that opportunity. But then second, I always see it as this is the company investing in me because they want me to be better. They want me to be, helpful in their overall role as a company, but then just as me as a person as well.
Mhm. I had one more question that I thought of earlier while you were talking, and I didn't want to interrupt the flow. But we were talking about certification and how, maybe not every company does that. And that was kind of news to me. But on the flip side, was there ever a time where you were able to get involved in the hiring process of, being in on the interviews and I guess maybe if you could talk about what some of the reasons might be for, or what some of the positive impacts for having a trainer on the interview process would be. So that way, maybe if some of our aspiring MSLs have a trainer pop up on their interview schedule, they might know a little bit about what they are looking for.
Absolutely. Yes, I have done a ton of interviews for the MSLs. I actually really enjoy doing it. It's a great way to meet people, but then also to just, hear about different things that people are working on and how they present, and it's all fun. Largely when I would interview people, my role, one, was to answer all the questions that came up from like, what does the onboarding process look like? And what does the ongoing training look like? So they always sent those over my way, which is great. But then the second bit that I was always looking for, I really focus on two areas. One, when they do their presentation, how are they presenting? What are they doing? What are the skills that they already currently have that they do well versus what would they need to learn? And this is really important because depending on the time when we had MSLs positions open, it really determined what kind of person we were looking for. So if we had an opening on a team that had a lot of senior MSLs, you could pull in a more junior MSL with someone who has limited experience because you've got this team that can really help bolster and support and pull them in. So if I'm watching somebody do their presentation and they've got great skills, they're really capable of presenting and clearly communicating their data, then it's in my head, I'm going, okay, this isn't going to need to take as much to get them up to speed to be out in the field. So that's good in terms of like if we are short somebody who's senior and we need to have that space. But the other thing I consider when I'm doing that is when I'm watching this second bit that I'm looking for is how coachable do they appear to be? So if someone asks them a really challenging question and they're not able to answer it, like how are they responding and are they really defensive? Because I worry about people who tend to be in that space because it means that they're kind of digging their heels in with respect to this is how I do it and you're not going to train me. And I want people who are coachable. I want people who are going to take feedback on board and really work towards making whatever small improvements that they need to do in order to really up their game. And so that's what I'm looking for is, how are you presenting? What are your skills? What do you currently have? How coachable are you with respect to those skills? Like what can we potentially work with you on? And then I always am always just looking at like personality wise, like are they easy to talk to? Are they, do they make eye contact? Are they, when we were doing more of it in person, that was more important then. But, when we did it a lot more online, it was, how engaging are you? Because your job as an MSL is to engage people and to have those conversations. And if you're sitting back quietly and not really speaking up or you're not engaging, then I kind of wonder, how effective are you going to be in the field? So I'm looking at it always from that angle of like, what skills do we need to work on? Where are we at? What's the baseline? What do we need to do in order to get them to be out in the field?
It's such a strategic move then to have you as a trainer sit in on those interviews because, whereas maybe the team members are just looking at like, okay, well, they mesh well personality wise. Obviously, they're smart, they know their stuff, but you have, as someone in that role, you have such a keen eye to look for all those other pieces that maybe are getting overlooked by team members or people on the commercial side or whoever else they're interviewing with. So it really is strategic to have your MSL trainer sit in on those interviews and kind of judge those aspects. So I appreciate hearing your thoughts on that.
I always really appreciated when I had the chance to do it because training in my world, when I was able to be in alignment with the medical directors and the field directors, it just made my job so much easier. I knew what they were looking for, what was the priority. I could design my trainings accordingly. And so really being a part of that group was just made my life so much easier. So every time I had a team that I could work with like that, sitting in on the interviews or being a part of the kind of the more holistic approach to the strategy and everything, it just really made such a huge, huge difference. And it made me a more effective trainer. So it was very, very much appreciated on my end when I had that chance to do it.
Well, Shannon, thank you so much for joining us and sharing all of your insights into the world of training. I learned a lot. I'm sure the people listening do too. It's interesting as you were talking, I was thinking, there are some companies that we work with that, as far as I know, they don't have a designated MSL trainer. And I started to wonder, what the difference in the outcomes looks like when you have a whole person dedicated to that versus somebody who, maybe that's a portion of their job. So be interesting to learn more about that. But loved hearing about what you do and what you've done. And I so appreciate you jumping on the MSL 411 podcast to talk to our listeners today.
Well, thank you so much for having me. I loved it. It's great fun.
Wonderful. Well, if you guys have any questions for us, visit the show notes. You can text us via that link below, and we'll see you next time.
Thanks for tuning in. If you enjoyed today's episode, don't forget to share the link, let your friends know, and of course, connect with us on LinkedIn. And if you want more information on today's topic, please feel free to reach out. Be sure to check back soon as we continue to explore the topics that matter most to you in medical affairs.